every single person decreased their self-reported and observer-rated scores of depression. So in other words, there were no non-responders, and that's pretty rare in diet or any kind of lifestyle intervention research.
Can ketogenic therapy help college students living with depression improve their symptoms? That's the question that a new study answered, and answered quite dramatically. Dr. Jeff Volek and his research assistant Drew Decker at The Ohio State University did this exact study, and I think the results are going to impress you. So here's the interview with Dr. Jeff Volek and Drew Decker. Well, Jeff Volek and Drew Decker, thank you so much for joining me on Metabolic Mind today.
Yeah, absolute pleasure.
My pleasure, Brett.
So Jeff, you and I had the pleasure to have an interview prior about the KIND study, the study that you're doing at Ohio State, where we went over a lot of the details. But I'd like, before we get into the results, which I'm really excited to talk about, I want to sort of rewind and talk about the makeup of the trial as well, for people who maybe haven't listened to that. So Drew or Jeff, why don't you give us the background of this trial?
Yeah, well, let me say right off the bat, it's great to be back here, Brett. I think when we talked, we were in the middle of the trial, and we were not in a place where we could really share the results in detail yet. So we're really elated now that the paper's been published, and we're free to talk about the results. And I'm thrilled to have one of my outstanding doctoral students here, Drew Decker, and I'm actually going to turn it over to him because he was really the person that was coordinating the trial and in the trenches, working with the participants on a daily basis. Got to know them very well and develop a rapport. So Drew, why don't you take it away and share the design of the study?
Yeah, it'd be my absolute pleasure, Dr. Volek. So major depression is a prevalent disorder globally right now. In fact, we saw an increase in its prevalence from 6.4% to over 20% just between the year of 2019 and 2020. This number doesn't seem to be decreasing at any significant rate. So it's an extremely prevalent problem within the world and in the US. And we're also seeing this problem be mirrored inside of college universities. For example, at OSU, we saw an increase within a significant increase in self-reported scores of depression between just a matter of months. Again, this does correlate with the onset of COVID. But again, that number is not declining at all. So it's an extremely prevalent problem. It's something that needs to be addressed. Currently, the two main ways that we treat depression is with psychotherapy or using medications through pharmacotherapy. Now, these two treatment plans, while they do tend to work in about half the individuals that are prescribed them, there is some ramifications, negative ramifications that occur from taking a lot of these medications, such as decreased libido, increased anxiety, and then in younger individuals, we even see increased prevalence of suicidal ideation. So a lot of these negative side effects of some of these medications seem counterintuitive to what we're trying to do when we're treating mental health disorder. So that leads to a need for more holistic approaches to this pandemic of mental health disorder. So that's when we started looking at ketogenic diet. So could the ketogenic diet be implemented in a college setting in order to decrease scores of depression or decrease the prevalence of depression? So that was the underlying reason for the study, what we were looking at. What we ended up designing was a 10 to 12 week dietary intervention where we were trying to assess feasibility of the ketogenic diet in college students suffering from major depressive disorder. And we saw great adherence to the diet. That was our primary outcome, was looking at adherence. Secondary, we were looking at, what it actually did to these scores of depression, as well as looking at different inflammatory markers and cognitive performance. And we saw great adherence to the diet. A lot of the students took to it and were really happy with it. We saw, body composition improvements. So and we saw decreased scores of depression, a rapid decreased scores of depression. In fact, in 2 weeks, we were seeing a 37% increase or improvement in scores of depression. And then that was sustained and improved upon to the end of the study, where we were seeing a 69% improvement. So that was the reason for the study. We showed feasibility, and we're seeing some pretty promising preliminary results here. So
Yeah, those results sound incredible, and I definitely want to sort of focus in on those a little bit more. But first, let's talk about the dietary intervention and the adherence, because we hear a lot that ketogenic diet is so hard to adhere to and so difficult, which I think is a bias that isn't necessarily true. But then if you even add to that people in college where you don't have necessarily a kitchen, you don't have complete control over your meals, there's lots of social interactions and not really a stable schedule. I mean, it's hard to think of a more difficult circumstance to try and stick to a certain diet. So how'd you work your way around that? And did you find that to be a factor?
yeah, so our workaround was basically we had a very inclusive and individualized dietary consult at the start of the study. So before individuals even started the study, we would sit down with them one-on-one and have a heart-to-heart conversation of, what are their dietary preferences? How do they socialize? Is that usually food-centric? And then we really tried to describe not only how to adhere to a ketogenic diet, whether it's staying lower than 50 grams of carbohydrates per day or, just foods to avoid, but we also focused on what foods can we incorporate that fit their personal likes, as well as what do they usually eat when they're at the university itself. So that way we could kind of modify and walk them through exactly how they should navigate certain situations. Furthermore, we also gave individuals access to a HIPAA protected app in which they're able to contact us through means much similar to a text message, while keeping them codified, where they could ask anybody on the research team any question they had. They could even take pictures of the food that they're eating, send it to us, and we could say, this looks pretty good. You might want to decrease or get rid of the grapes, or, decrease this or that. So that really helped that we had this daily communication if they wanted it. A lot of the participants, I'd say most of the participants, after the initial consult, didn't really utilize that app too often, and they did just fine. Some participants definitely needed a little bit more attention, where they just wanted to ask a few more questions, see what they maybe could get away with, or, where they were at. So,
Yeah. And were you checking ketone levels either with capillary BHBs or some other measurement?
yeah, so it was through a capillary BHB measurement. We did this every single morning while they were fasted. So individuals would send that in. We were able to see that real time, as well as glucose.
Okay, very good. And how many participants were there?
So after baseline testing, we had 16 completers. We had 24 participants that ended up coming through baseline. So it was a pretty good number. I would say that there was with a 33% dropout rate. A lot of this was due to the schedule that the individuals had with college, or going home during food-centric holidays, or stress from exams. So that was definitely a hurdle that we had, and I think that we learned a lot of valuable lessons to be applied to future studies, especially around recruitment times, which semesters tend to fit a little bit better.
Yeah. And maybe a proactive interaction of, expect increased stress, and here's what you can do. Expect that you're going to travel and food's going to change, and here's what you can do. Yeah. So really valuable lessons there, I'm sure. Yeah.
I would add that, just to, add to what Drew mentioned on that description, we, as another feature of the intervention, we did provide some food to participants, especially at the onset, to get them off on the right track, and while we're educating them on the principles of a well-formulated ketogenic diet. So they had sort of that food provision as a perk and as sort of an assistance to teach them what appropriate foods look like. And the goal, though, of course, was to wean them off the food provision so they could learn how to do this on their own in the real world.
Yeah, that's a very good point, Dr. Volek. Thanks for bringing that up. So those first 6 weeks is when we're providing food of some sort to them. So we'd give them 5 full meals that allowed them to get an idea of what a ketogenic meal would look like. And then after that, for the next 5 weeks or so, they could come in whenever they want and get different food items. So this could be different sauces that would be keto friendly, or they could get, electrolyte packets or something along those lines. And then the last 6 weeks, individuals were largely on their own, just running the diet. So there was a good 6-week lead into individuals running entirely on their own.
And now, Jeff, I want to ask you, I mean, you have more experience in ketogenic research than probably anybody on this planet. But this was relatively unique to look at specifically depression, specifically in college age individuals. So I'm curious, with all your research experience in ketosis, what did you think about the feasibility and maybe the mechanisms of how this could work, what kind of impact it would have? What were your sort of preconceived thoughts as you came into the trial?
Yeah, we have studied ketogenic diets in a variety of populations over 30 years for me almost. Men, women, lean, obese, healthy, elite athletes, and then really, really sick individuals too, cancer patients, heart failure patients. However, this was the first population specifically that we've studied in the lab with a mental health disorder. So we assumed that they would be compliant, just like we've achieved in all those other populations. But of course, we needed to demonstrate that. But I certainly think that the thinking going in was that we're not really going to do too much different. The principles of the ketogenic diet remain more or less the same as we would implement in any of those other groups. So we had a good sense that this would be feasible and we could do it. But of course, you need to actually demonstrate that. Proof's in the pudding. And Drew can probably speak to maybe some of the more unique or specific challenges with this group. I mean, just being the younger college population, as you alluded to earlier, Brett, there's some challenges there. But in general, I think we thought we could do this going in. Otherwise, we wouldn't have tried it. But and I think, as Drew pointed out, we were more or less correct. We could do this at a pretty high level in this population.
Yeah. So Drew, you went over some of the interventions that you had in the app and the sort of the availability of coaching. And with that, as you mentioned, you saw outstanding adherence. So tell us again what the data showed about the adherence.
Yeah, so we had individuals were reporting their glucose and ketones 77% of the time. And of that 73% of the time, individuals were at a state of nutritional ketosis defined by 0.5 to 5 millimolar. So, it was incredible. The vast majority of the time, individuals stayed in ketosis. And I think a big driver to why a lot of individuals, why we saw our success, was just how they felt on the diet. I had individuals come up to me, one in particular who he came up and he said, "Drew, you won't believe this. I just failed an exam, and the same week I just got redlined by my advisor on my thesis. So this usually would have put me over the edge. I would have to go home. I want to be able to work on it for a week." He said, "I just got right to work. I just took the criticism and took the loss and just realized I could just do better and keep on going." And he truly believed that this was stemming from the diet. And he was excited for it. So I think a lot of our success has to come from how the individuals felt on the diet. They were perceiving that this diet was beneficial for them.
Yeah, that subjective feedback is so important, but something that's often not incorporated into the publication of the paper, because it's not necessarily objective data, but that self-reported feedback can be so valuable. And I'm sure you saw a lot of that. But did you also get feedback that, oh, this was easier than I thought it would be, or yeah, this was really challenging, but I'm glad I stuck with it? Like, what was your feel of the participants from that standpoint?
Yeah, so it depended on the individual. For the most part, I would say the first week or two was a little bit rough. That's when we had the most interaction with the app that we were using. But after that, it seemed everybody got the hang of it, especially after week 2. People started realizing what their favorite meals were, what they enjoyed, how to shop. what to keep the cabinet stuff filled with. And after that, it was pretty smooth sailing. Again, a lot of times individuals didn't need much contact or help after the first couple weeks.
Yeah, that's great to hear. Certainly the feasibility part seems very impressive. But then you also mentioned some of the depression scores, which improved dramatically. So tell us more about that.
Yeah, absolutely. So we were using 3 different surveys to measure individuals' score of depression or their global wellness. We used the PHQ-9, Patient Health Questionnaire 9, which is a 9-item questionnaire. The lower score denotes an improvement in depression. We also used the Hamilton Rating Scale of Depression. This is an observer-rated score of depression. So individuals would actually come into the lab. They would talk with a trained psychologist, and the psychologist would be able to give them a score not just off of how they answered the question, but also uh, different physical cues that they might be having. Maybe one was crying when they were answering a question or trying to not make eye contact with the observer. And that would also affect score. And then we had a survey that assessed overall wellness. So for this score, it was a positive score was correlated with an improvement in their well-being. And so for the PHQ-9, we saw a 37% improvement by week 2. And this was sustained throughout the rest of the intervention. So week 2, we're having a huge improvement. And this is sustained and improved all the way through until we're having a 69% improvement by weeks 10 to 12. This was further shown with a Hamilton Rating Scale of Depression, where we were seeing a 59% improvement by week 6, and we were seeing a 71% increase by the end of the intervention, or improvement by the end of the intervention. So with these 2 surveys, we're seeing that not only are individuals having significant improvements, statistically significant improvements, but we're also seeing clinically significant improvements as well by week 2 and then sustained throughout. So this was absolutely incredible for our scores of global wellness. We saw no decrement at all. We only saw improvements throughout. So again, all 3 surveys that we were handing out to have these scores of depression or their wellness showed only positive effects throughout.
Yeah, I mean, that's really dramatic. And I'm glad you clarified the statistical significance and clinical significance, because a lot of these surveys have sort of a threshold of clinical significance in change. And it sounds like you more than hit that in the evaluation and the results. So Jeff, let me turn to you. I mean, were you surprised in any way by the degree of improvement and the rapidity, how fast people improved, or was it sort of along lines of what you expected or hypothesized?
Yeah, I think we certainly came in with the hypothesis we were going to have some benefit, but I would say the magnitude of the response was a little surprising. But even more than that, Brett, in diet intervention studies in particular, it's so important to look at the individual responses. Because no one responds exactly like the mean or the average. When you look at the individual trajectories and responses to the intervention, every single person decreased their self-reported and observer-rated scores of depression. So in other words, there were no non-responders. I mean, and that's pretty rare in diet or any kind of lifestyle intervention research. So the results were very consistent and reliable across people, suggesting that this is a pretty robust tool for improving depression if people are willing to adopt the diet and be compliant. So that's even more impressive to me, is how consistent the responses were across participants.
Yeah, that really is amazing. Just to say that statement, there were no non-responders, is remarkable. Fellow mental health clinicians and healthcare providers, you now have access to a suite of free CME lectures on metabolic psychiatry and metabolic health. Each of these CME sessions provide insight on incorporating metabolic therapies for mental illnesses into your practice. These CME sessions are approved for AMA Category 1 credits, CNE nursing credit hours, and continuing education credit for psychologists. And they're completely free of charge on mycme.com. Now back to the video. Now, the pushback, again, as is against almost any pilot trial, is, okay, it wasn't randomized, How do you know it was the diet effect and not just because they were part of a study and getting more attention? And, you don't usually start with randomized controlled trials, but what do you think about that? And are there plans in the future for a randomized controlled trial?
Yeah, I'll quickly just comment. For sure, there's limitations in this study. It was a pilot study, as sort of a proof of concept. Should we explore this further, kind of thing? And of course, the data more than justify and inspire us to want to follow this up. But we don't have a control group, so we can't rule out just people getting better over time because they were engaged in some counseling programs, and there were a few participants who were on medications as well. So, from a research and sort of experimental design perspective, we have some limitations. We cannot truly isolate the effects of the ketogenic diet here. Having said that, I'm not aware of any placebo effect or even current treatment, whether it be cognitive behavior therapy or medication, that would produce this level of improvement and this consistency of improvement. So it doesn't really discourage my enthusiasm for the results. It just really makes makes me want to definitely follow up with this with a more rigorous experimental design with controls and comparison groups where we truly can isolate the magnitude of the effect of the ketogenic intervention.
Yeah. Drew, you have anything to add there?
No, I agree with everything Dr. Volek said. And yeah, absolutely. This kind of research needs to continue, and definitely encouraged to jump on this and keep on running with it, and include some of those control trials and really try to put the nail in the coffin on how ketones affect mental health disorders such as major depressive disorder.
Yeah. And when we have an early, I guess you could call it early trial like this, being a pilot trial, not, thousands of people, the question always comes up, well, how could this impact clinical practice now? And I know neither one of you are clinicians and you're not giving medical advice. I'm only asking for your opinion. Do you think a finding like this, that every single person responded and the degree of response and the consistency of response, that a doctor should look at this trial, even though it's early, and say, hey, maybe this is something I should start implementing in my practice now? Do you think the results justify that?
I mean, I would say yes to that, especially if you're looking at it just from a health perspective. What do they have to lose by implementing the diet? By having them go see a registered dietitian or somebody trained with the ketogenic diet, help really formulate a plan for them to follow. The way I look at it here is it won't hurt. At the very least, it won't hurt. And, you could see some extremely meaningful improvement for these individuals that are suffering. Mental health disorders don't just affect the individual, but it affects their families and their loved ones. So a lot of these individuals are desperate. They need more help, so if we can throw another holistic approach, why wouldn't we?
Yeah, and I would agree with that, because we're not obviating other treatment options. This is an adjunct, and people have to eat every day. They have to make decisions. Okay, what meals am I going to make, and what am I going to consume? And it doesn't mean you still can't participate in other treatment options. So it's really, as Drew said, there's little downside to this. We did not observe any serious adverse events or any, as I said earlier, non-responders. So there's virtually no downside other than you'd have to change your diet and make trade-offs in terms of some of the foods you're consuming. And then there's, huge potential upside. So I think, if I'm not a psychologist or psychiatrist, but I would certainly think bringing this up as an option to patients and clients and people would be wise and prudent at this point.
And I'm glad you brought up that you didn't see any adverse effects. So just to clarify, so you were monitoring for certain adverse effects and side effects and negative outcomes. So you're monitoring for those. And did any pop up during the study?
No, so we didn't have any adverse effects from the diet itself. We had, again, with that that consult that we had before individuals came in, we definitely stressed electrolyte or increasing their electrolytes, just so that way we could avoid that classic keto flu. You know, and we did. I didn't have anybody that said they were suffering from brain fog or from feeling a little bit down in those first couple weeks. So I think that that helped with a lot of things. But yeah, we didn't have any adverse effects throughout the 10 to 12 week intervention.
Yeah, I think we did a complete metabolic panel, blood lipids, all sorts of liver and kidney function, so forth, all remained in the normal range.
All right, so one other question is, you mentioned the degree of improvement at 2 weeks and then how it increased over time up to sort of 69% increase, I think you said. I mean, that sounds dramatic. So how do we put that into perspective of SSRIs and other antidepressants and other treatments? And I know, it's probably all over the place depending on the study, depending on the intervention, so it's really hard to compare. But do you have any sense of how this fits into that?
Yeah. So when we're looking at different treatment plans, so psychotherapy and pharmacotherapy, or a combination of the two, we see success, or success has been seen at a similar rate for what we were seeing on our trial. One of the biggest differences, though, is that, like Dr. Volek said, we had no non-responders. And this is seen with psychotherapy and in pharmacotherapy, especially, where, it tends to work in about half of the individuals, the other half maybe not so much. So I think one of the giant takeaways from this study was everybody was responding in a very positive manner to the intervention.
Yeah, that is pretty dramatic. All right. Well, any other results that you wanted to bring up or mention?
Yeah, I think the some of the other more metabolic markers are worth mentioning. And for context, this group, and I think this is a feature of them just being young adults, they were relatively, at least on the surface, metabolically healthy. Their glucose was in the normal range. I don't think any participant was even pre-diabetic, let alone diabetic. So they were healthy just in terms of their insulin resistance status, for the most part. They were also, on average, normal weight, although we had some variability. But the mean BMI was 25 or 26, I believe. Having said that, and this is very consistent with what we've seen in many other populations, there was a significant weight loss, and we did a very accurate measure of body composition with dual energy X-ray absorptiometry, which gives us their body composition, percent fat, lean mass, fat mass, and the majority of that weight loss was from fat mass. So again, the consistency here, every single person, either there was a couple that maybe stayed their same weight, but everybody else lost weight and improved their body composition. So that's always a perceived benefit for almost everyone who adopts a ketogenic diet, and that was certainly the case here. And I think, there's a potential for that to feed back and improve self-esteem and so forth, that may have contributed to the reductions in depression. And then I think there were also a few biomarkers we looked at in the inflammatory panel and that hormonal panels that were also consistent with prior work. Specifically, leptin levels were considerably lower, and we think this is a beneficial effect in terms of lower inflammation, improved leptin sensitivity, and so forth. That mirrors many of our other ketogenic interventions. So this improvement in depression, it's coinciding with other improvements as well, which I think is important, that we have a lot of arrows going in the right direction, not just the depression scores.
Which even, as you mentioned, with losing body weight maybe playing into an improvement in score of depression, I think that goes back to your question, Dr. Shear, if should a clinician implement this diet based off of this study? I mean, whether it's even, let's say, play the devil's advocate and say that body composition was a player in that, well, then we're still seeing improvements in body composition. So again, can't hurt.
And we probably should make cognitive too, Drew. Maybe you can take that one on, the cognitive performance. So we had several domains of cognition improve.
Yeah, and we also see improvements with a lot of the cognitive performance. So we implemented the NIH toolbox. This was done at baseline and at the end of the test or the study, and we saw improvements on different on select tests of cognitive performance, including auditory verbal learning, oral symbol digit tests, and improvement in pattern comparison. So we were seeing improvements in cognitive performance, and we saw no declines on any test within the training module or the testing modules. So adds more power or more strength to the intervention itself, I would say.
Yeah, well, very impressive. Very impressive results. I'm not sure anybody could have predicted, 100% response and the degree of the response. And so I definitely look forward to seeing more research on this. As Jeff said, I mean, it clearly suggests that there should be more research on this in the future and with larger, randomized controlled trials, et cetera. But so if people want to learn more about you and the work you're doing and find out more about you, where would you direct them to go, Drew?
Yeah, so you guys could go to Low Carb OSU, and that's a website that we have, Low Carb OSU. And you could also follow me on Instagram. It's Drew_D__ Decker. So that's where you'd be able to follow me and follow the works of the Dr. Volek's lab as well.
Great. Well, I want to thank you and Jeff very much for joining me, and thank you for all your work.
Of course, thank you very much.